Good morning all, welcome to this LCMB webinar where we'll be covering the subject of how do you safely return to the workplace. So as I said, we'll get started in a minute. I'm just going to give it a few minutes. Let's see if there's a couple of latecomers. It doesn't seem like it, so let's get started. So let's start with the agenda for today. We'll start with a bit of housekeeping. An introduction. We'll cover the three elements of returning to work safely in a fair bit of detail, look at some next steps, and then there's a chance for some questions towards the end. So if you've got any questions, feel free to use the chat or you can hold them to the end. If you want to ask a question, you will need to unmute yourself in order to do so. So start with the housekeeping. As I said, first of all, everybody you're welcome to unmute yourself and ask a question. Please note that we are recording this. Let me just let somebody else in. We are recording this webinar and we will make it available towards the end. The chat box is available for all to see. And then last but not least, there is an opportunity for questions. But as I said, if you've got anything pressing, please do feel free to interrupt and ask or use the chat box to do so. Okay. So let's get started. Firstly, an introduction to LCMB and then myself as well. So LCMB has been around for 10 plus years now, and we're a boutique consultancy and we work with our clients to make their buildings contribute to their organization in the most effective way possible. So that could be through the physical layout of them, it could be through how they operate it, it could be through some project management related to things like buildings and facilities management, all of those things. So if you need any help with any of those things, then please do get in touch with us. Okay, about myself, I'm the Director of Operations at LCMB. I've been with the organization since 2014. My background is I'm a qualified civil engineer, and then for my sins I fell into FM and I did a master's in facilities management. So I've been running, operating, building, demolishing and sort of generally operating within the built environment for quite a long time now, longer than I'd like to care to admit. So what are we going to talk about today? 2020 has been a very, very strange year, to say the least. When at the start of the year, we all thought that our biggest issue we're going to have to deal with was going to be Brexit. And if not Brexit, then things like Australian bushfires were high on the list. But as it turned out, they're not. Nobody could have seen it coming that we're all going to be wearing face masks everywhere. There's going to be posters about staying at home. Social distancing was not a term that any of us had heard. We never expected schools, shops, offices, airports, everything to be cancelled, including sport. We never expected that every single meeting we had in 2020 would be online and not in person. We never expected to quarantine. Who'd have thought that we go to mainland Europe and have to quarantine when you come back? New words have entered the dictionary. I mean, I put COVIDiot there. That's not something that existed a little while ago. And nobody could have foreseen that the shelves on shops would be completely empty of something as simple as toilet rolls. So it's been a strange year. It's thrown up a few challenges. But the question that we need to answer is, are we talking about the death of the office? Now, the answer is a little bit more complex than a straightforward yes or no. In my view, I don't think we are talking about the death of the office, but we may well be talking about some tweaks to the office that needs to be made. So let's get started. There are, as we said, three elements to making a return to work, and we'll deal with them in turn. The first thing is the changing guidance, because as we all know, the guidance changed again this week. The second thing is, how do we keep our people safe? And then last but not least, how do we create a safe workspace for people to operate in? So if we start with looking at the guidance first, 3 elements really. The key thing for me is to stay calm. The rules, guidance, and everything that comes out around COVID-19 from government, from trade bodies, from everything is very, very, very fluid and ever changing. So stay calm. Take a step, make yourself a cup of tea or coffee or beer if it's late in the afternoon, and have a look. Just think carefully about what it means for you and your organization. Related to that, check your sources. One of the biggest issues that we've got lately is doctorates from the University of WhatsApp or whatever you want to call it. So if somebody tells you that a particular bit of advice is in place around COVID, make sure that this is accurate. Check your sources. The government has actually done a pretty decent job in making the advice available and clearly explaining what things are. Now, at times, the guidance has been a little bit confusing. So can you be 6? Can you be 30? And so forth. But that's improving all the time. So check your sources. And sadly, that doesn't mean that you can always rely on the press. I'd go right to the top directly. And last but not least, get some help and advice. The organizations like ourselves are out there. We can help you. We can do some of the work for you. We can even have a look at things that's not related to COVID and how they might influence things. So if you're not certain, ask. And you don't just have to come to us. Obviously, I'd be very happy if you did. So talking about keeping people safe, first and foremost, risk assessment. This is the fundamental of all health and safety, and the term risk assessment shouldn't be alien to anybody. But when it comes to COVID, who should be back in the workplace in the first place? How are they going to get there? How will you deal with movement within the office? And the last point on there, I think, is quite pertinent. Would your money be better invested in your staff than your real estate? And that's not a question that I can answer for any organization. You'd have to ask that for yourselves. But it is definitely worth considering. Okay. So then moving on to the safe workplace. And this is the physical environment. Let's start with people and their well-being. And then we look at how do these people get to and from work. And that also has to include how they move around within work. The physical distancing, there's some confusing guidance about that, but we'll come on to that. And then the general hygiene, cleaning and so forth. And last but not least, building systems, how the place operates. So let's start with people and their well-being. Sorry, I'm having some difficulty with my slides. Let's start with people and their well-being. We can't underestimate or overstate just what a disruption this COVID-19 situation has caused. It is a terrifying situation. The death toll speaks for itself. So give your staff all the time and support that they might need so that they can get back to their best. Oh, sorry, the slide deck is playing up. If you've got the occupational health capability, then give staff the usage that requires. And then the last point on there, and it's probably the most important, give them regular chance to provide feedback, ask questions, and air their concerns. Some of them may be very minor, some of them may be far more serious. But if you give them a chance to air the minor ones early, they don't have a chance to fester and develop into serious concerns. It's also easy to solve problems if you know about them sooner. Related to this people and well-being, you also need to think about the wider picture within people's households. So just your member of staff lives with others. There might be some vulnerabilities, there might be some shielding, there might be some other concerns that you're unaware of. Under normal circumstances, this might not affect the organization, but within a COVID situation, if somebody's been on holiday and they need to quarantine, that might affect your member of staff as well. So do consider that as you go. Getting to and from the workplace. Let's deal with in and out safely. Now, public transport is an interesting one because, yeah, for our own organization, we tend to say to people, don't use your car unless you have to. Use public transport. But right now, with COVID hanging over our heads, that might not be the best way to do things. So how will that affect your staff? How will they get there? Can they drive? Is there a sensible route for them to drive, or does it take much longer than it should? Can they park? If they can't do any of those things, is walking feasible? Can they cycle? Is there sufficient space for them to leave their equipment and change? All of those things. And these are sort of ordinary concerns for a facilities manager, but at the moment they just take on that bit higher priority. The second part of that is getting around inside the office itself. So do you need one-way systems? Can you go in one door and out the fire door, for example? But don't forget about the security of the building and the staff inside if you need to do that. Also related to that is, are the one-way systems actually going to comply with your fire strategy and things like that? This comes back to the risk assessment. You need to look at all the elements. You can't just think of COVID in isolation. And then once somebody is in the office, sitting at a desk, can they get up? Can they stretch? Can they be productive? Yeah, because if they're at work but unable to be effective, then should they actually be in the office? Should they not be working from home or elsewhere? Related to that as well is things like lifts. Now, lifts are particularly problematic because very few of them are large enough to have the social distancing that you need. But the government have come up with some sort of suggested layouts for people sort of facing away from each other within a lift. So you might consider that. You might consider a sort of one in, one out policy. But if somebody's got to travel many floors up the building, how's that going to work? Also, if you implement a policy like that, you've effectively made that part of your health and safety plan. So how are you going to police it? Because you can't just say this is what you should do and then let people do whatever they want. So there's a fair few things to consider there. I've come up on physical distancing. So the initial 2 meter guidance hasn't actually changed. The government have said that you can go down to 1 meter plus, but the best practice guidance is still a 2 meter distance. So please bear that in mind. Oh, sorry, somebody else is joining. So can you move desks or chairs or simply take them out of service so that you maintain this 2 meter barrier? Do you need some physical screens and barriers? Now, physical screens and barriers are a good idea, but there is a cost implication and there is also a cultural implication. And what are you going to do after this COVID crisis has passed? You're going to keep them up? You're going to get rid of them? What's going to happen? There's waste to consider there as well. It's all solvable, but you need to just consider it at the start. Staggered shifts and flexible work patterns. This is probably going back to working from home in a large chunk. Flexible work patterns really has I think, surprised people with how effective they have been during lockdown in particular. The effectiveness of staff working from home has been really quite good. There are some things which a physical office space just can't be beaten for. I mean, sitting down with somebody and thrashing out a problem over a coffee or whatever is very difficult to do if there's a screen between you. But that doesn't mean you can't have a little bit of overlap and still maintain enough space for people to be socially distant. So does half your workforce want to start early and finish early, or even work in different locations, or all sorts of things like that? All of these things are viable and feasible. They just need a little bit of consideration. Last but not least, remote working, I sort of covered. The use of technology and workplace PPE. Right? We've all got used to having meetings over Zoom or Teams or whatever it may be. So do you still need to consider using those for meetings internally, even if people are inside the same building, rather than put them in one room? If it works, it's worth thinking about. Workplace PPE is last on that list for a reason, because PPE in health and safety hierarchy should always be the last thing you consider. And it's no different with COVID than anything else. General hygiene then. I think how clean the environment is almost less important than how clean people think the environment is. If people see lots of cleaning, if they can see that the organization is taking lots of steps to keep them safe, and things like last cleaned by and labels, updates, you might want to send a little newsletter out regularly to say we've done the following with our cleaning regime. The last thing you want in an office right now is for somebody to use the facilities and there's not enough soap, hand sanitizer, tissues, etc., etc. It's really important that you keep that up to date, and if you do, people will notice. So my message on general hygiene is, obviously you have to do good cleaning regimes, and you probably have to take more care than normal at the moment. But consider daytime cleaning, consider making it as visible as you possibly can, so that there's no question about people feeling that you've skimped on cleaning and they are potentially vulnerable. Part of this as well is the sort of issue of self-cleaning. So you're perfectly entitled to ask your staff to clean up after themselves and wipe a desk and so forth. But if you're going to do that, just make sure that there's the ability to do it before and after, so that everybody's got the confidence that they know what's gone on. Right now, there's no such thing as too much cleaning either. The building systems, this is the physical, how the buildings operate. The first point I put on there is about thermal imaging to check on staff and visitors, and temperature checks essentially. So most barbers now, if before people go in, they take a temperature check. So even in the last 6 months, the kind of cultural acceptability of having your temperature checked seems to have changed. So is this something that would benefit your workplace? Should you be considering doing it? And if you are going to do it, just make sure that you know what you're doing with the data and deal with privacy and cultural issues. As I said, I think over the last few months that's become much more acceptable, but don't just assume. Take care. Air changes, the next point. And this comes directly from the government's own guidance, that your system should be providing fresh air rather than recirculating. Now, in modern offices, that's not always possible, and the percentages sometimes can't be affected. If that's the case, excuse me, make sure that people know exactly what's going on. If your HVAC system needs ramping up or running more time, then please do so. And if you've got windows that can open, then they should be open. It's difficult now as we enter into the colder months. And I'm aware that many offices won't have windows that can be opened. But I think one of the key things that we need to provide as operators of workplaces is as much fresh air as we possibly can. Lift is on there as well. I've already discussed this. Do you have an uplift and a downlift, for example, and so forth? And then last but not least, automation. Now, I appreciate this might be expensive. It might not be practical in all situations, but if you can avoid people touching doors, even walkways, anything like that, it would be beneficial. So if we look at the next steps, and we're nearly at the end, the first thing is risk assess. Now, there's some tools on our website about how you can do that. Feel free to have them, have a look, download them, get in touch. We can help you out. The next thing is communication. And for me, this is absolutely key. Talk to your staff an awful lot. Chat to them, write to them, email them, message them, use WhatsApp, Skype, Zoom, whatever is available, talk to them. And just because you've told them something, don't assume that they've received the message. I think it's really important that you repeat the message time and time and time and time again. Typically with staff, you have to tell them, and then you have to tell them that you've told them, and then you have to tell them that you've told them that you've told them, and so on and so forth. And eventually the message will sink in. COVID is probably higher up on people's priority list, and they're worrying about it more, so they might pay attention sooner. But it's still a really good idea to just keep hammering the message home. Tell them what you're doing and tell them how they're keeping safe. The same will apply to rules about checking themselves before they come to work, etc., etc. And then last but not least, review and challenge your own findings. Just because a one-way system worked today doesn't necessarily mean it's going to work tomorrow. The same for screens, the same for temperature checks, the same for lift operations, all of that. And then that goes back to the changing guidance as well. So if you've come to a conclusion with a particular approach that works because given the current guidance, once you've finished doing that, the guidance might change, and suddenly you can no longer fit 8 people in a room. You can only fit 6. So this is a movable feast, and it changes all the time. Just keep reviewing and referring back. It's also the regular review will mean that you don't get complacent, because you'll be looking at everything with a fresh eye and carrying on reassessing and reassessing and reassessing. So in conclusion, excuse me, I think that the key thing for me is that to get people back into the workplace must deliver something that your employees can't get anywhere else. And whether that's social interaction, whether that's technology, whatever it might be, if it doesn't, then your employees may as well work from wherever they are. I think that the pandemic has shown that the workplace is flexible. Most people can work from outside of their usual desks. And so make use of that ability. Second thing is where you spend your money. People investment, a bit of training, a little bit of better equipment, better welfare facilities, all of those things are going to return much greater benefits than building investments. I wrote a blog some years ago about working in pajamas at home. I think we've all discovered the joy of that. The commute across the hallway has become normal for a lot of us. And if you can invest in your people to make them achieve that much more, then do so. A better building is great, but your people investment will return better. There's a little analogy that I like to share at this stage. If we think of EasyJet, big airline company, top 100, multi-million-pound operation, they needed new headquarters because their shed at Stansted Airport had grown too small. So big corporate organization like that, you'd expect them to go and build something fancy, a big glass front, oak paneling. That's the sort of thing that you'd anticipate. The organization went one step further. They went and built themselves a bigger shed at the airport because that's all they needed. And they decided to invest in their pilots and staff much more than just a fancy building. And it's paid off. They're one of the few low-cost operators that has continued to thrive, and they're still around today. The next point there is this thing is with us to stay, unfortunately. So take it slow, take it steady, roll with the punches. Things will change again. I wish that wasn't the case. We started talking about this in March, and we're now comfortably into September, and the workplace is only just starting to re-emerge. So that leaves a chance for any questions. If anybody's got a question, feel free to put your hand up, unmute yourself, or use the text function to ask any questions. Nothing? No questions from anyone? Oh, wow. Must be clearer than I thought I could be. Well, if there's no questions, I'll move on. Okay. So in conclusion then, just a little reminder, on the 15th of October, John, our MD, will be running another one of these LCMB webinars. He's going to be looking at estate strategies for a post-COVID world, particularly trying to focus on the messages coming out from the crisis and how do you deal with them, and the new normal that you need to implement into your real estate lessons. Sammy's got a question. Feel free to unmute yourself and ask away, Sammy.
Hi, thank you very much. Is it possible that you take question maybe beyond the scope of the presentation so far? Because I'm still actually not sure about the alteration being made to some of the offices. Is there sufficient evidence to support such alteration into the building and the premises itself? Thank you.
Okay, that's a good question. So if I understand it correctly, you're asking about the evidence around the alterations for COVID specifically. So the first place to start is the government's own guidance. So they published back in May, the government published a document around returning to the workplace, in which they set out the sort of requirements for social distancing and one-way systems, and some ideas for how you might deal with lifts, etc. So that's the first bit of advice I'd seek. Every workplace will be slightly different. So if you normally have, let's say, for example, 10 people in an open plan space, it could be that you can operate with 8 if you move things around cleverly and face things the wrong way with some screens, example. But in another setting, that's going to drop down to 2. So it's going to be unique to your setting. It's going to be unique to what your business requirements are. Very happy to have a conversation offline to have a look at anything more specific and see if there's something we can advise or help with. It's difficult to make a judgment on a quick question as this without looking at the facts. The overall impact of alterations is also a very tricky one to balance, because you can't just go and change your office for what we all hope is a temporary situation. There's no point in throwing out the baby with the bathwater. You want to be future-proof beyond COVID, and we're all. Yeah, I suspect it might not be gone in the next few months, but we're all hoping that it will be. So to answer your question, I can't really answer your question without looking at much more detail. Alterations is a personal choice, and your organization will have to make your own decisions, essentially. Hopefully that's addressed it. Any further questions? Nothing? Okay. That will almost bring us to a close then. So we've got a full guide on our interpretation of this, which is based on assessing the government's own guidelines as well as some industry standards and looking at some places. Sorry, there's a. Thank you. Okay, Sammy, no problem. If you'd like to, if you've got any questions, my contact details are on screen. As I said, we will make the video of this webinar available. It'll go up on our website sometime over the next few days. So feel free to rewatch it. Feel free to get in touch. If you've got any feedback, any questions that you think about after the conversation, or even if you'd just like to have a chat, happy to have a virtual coffee or even an in-person coffee now. Just please do get in touch. And look at our website. There are some useful guides. There are tips. There's some implications of how we see things going. You can also sign up for our newsletter, and you can sign up for the next webinar, which is on the 15th of October, as I said. So if there's no further questions, I'll bring this meeting to a close, and I thank everybody for your time. Thank you for joining us.